Dr. Gomez, I would like you to talk a little bit about what we patients can and should do in terms of flossing, brushing, dental hygiene at home. Which equipment should we use? How should we go about it? What's your viewpoint on it, your take? Because different doctors seem to have a slightly different opinion. So tell us what you think we should be doing. What do you tell your patients?
Well, usually when a patient comes to the recall visit, I try to instruct them how to do their cleaning at home. So I would recommend the patient to brush at least twice a day, in the morning and at night. And if they can, in between, that would be better. But if they cannot, then at least they have to do it twice a day. And I want them to brush their teeth first, then they have to use the floss, and I teach them how to do it. And they really have to, go under the gums when they're using the floss, because a lot of patients, they just go up and down and they don't really clean the teeth. They just go in and out without doing any work. So I make sure that they know how to floss and how they have to do it, and
tell us a little bit how.
If they want, they can.
Tell us a little bit. See whether you can explain it a little bit how we should floss.
You take the floss and you go in between your teeth, but you have to put the floss against the surface of the tooth that you want to clean. If you just go in and out the space, then you're not really doing anything to the surface of the tooth. So you have to make sure that you put the floss against the surface of the tooth that you want to clean. And that's the only way you're going to remove the plaque. Otherwise, if you just go in and out, you're not going to do anything. You might get out some of the food that might be trapped in between the teeth, but the plaque that is added to the surface of the tooth, if you don't really go against that surface, you're not going to be able to remove that. So that's what I explain to the patient. I teach them how to do that, so they learn how to floss when they home, and they keep the teeth, free from tartars.
Is it a good, let me ask you a question, is it a good thing, or is it advisable, or is it not advisable that, you take your floss and you kind of press it also against the gums, or not really? Is that kind of aggravating it too much, or what's the deal there?
No, it has to go against the surface of the tooth, but you have to go a little bit deeper into the gum tissue, so you also kind of giving a little cleaning to the gums and a little massage also to the gums.
Okay, good. All right, thanks for clarifying that for me. And you were about to say about brushing. The
brushing, they can use any brush. The patients that have difficulty brushing, or the elderly patients that they cannot use their hands very properly, I would recommend to use the electrical brush, because it's easy for them to do it. But if you're okay and you can use the hand brush, it's fine. But you have to brush for at least 2 minutes. You got to stay on the tooth, and you have to make sure that you really clean the tooth. A lot of patients, they tend to do it too quick, and because they do it too quick, they don't really clean the teeth properly.
Okay. And what about soft toothbrushes, hard ones, a different type of toothpaste, yes, which is important?
Toothpaste, I will say that even though they might be adult patients, I always recommend to have some fluorides on it.
Okay.
And the brush that I recommend is a medium soft brush. I don't like the hard brush, because that will damage the enamel of the teeth. And also sometimes can cause problem with the gums, because if you go with the hard brush on close to your gums, the gums are going to tend to recede, and then you're going to have some of the root exposure as a consequence of the aggravation of the brush going against the gums. That's my experience. They might be that might somebody might not agree with that, because everybody have different view of different opinion. But that's what I feel, that if you use a hard brush and you go against your gums is going to react to that aggravation and probably going to recede on it.
Right. Okay. Okay. Yeah. That makes that makes sense. Now, about I don't know, 15 some years ago or so, I spent a couple of years in India, and almost everybody there used a tongue scraper. And ever since, I don't use a tongue scraper, but I do brush my teeth, my tongue and my gums with the toothbrush. What's your opinion? Is that a good thing and unnecessary?
I'm very good fan of tongue scraper. Actually, I give it out to my patients. That's part of my goodie bags that I give to my patients. I always put a tongue scraper, toothbrush, and a floss in the bag when they come for cleaning every 6 months, because I'm a very good fan of the tongue scraper. A lot of bacteria stays in the tongue, and sometimes when you go with the brush, you don't really reach that far enough to get all the bacteria out of your tongue. So with the tongue scraper, you really can, go a little farther than that you usually can go with a brush.
Okay, so basically, somehow cleaning your tongue is a good thing.
It is a good thing because a lot of the plaque hides on your tongue. Some patients say, I have bad breath, and if you look at the teeth might be clean, but the tongue is white. And that's because they have a lot of plaque on the surface and a lot of bacteria on the surface of the tongue, because they don't know how to clean the tongue, or because they don't really clean at all. So I try to teach my patients also to do that.
Okay. Here we go again. Okay. Informative. I'm sure people can do something with it. Dr. Gomez, bye-bye.